I'm a radiology consultant and I've been involved with screening programs for the last 20 years, and in particular I've been working with Dr. Seven with Lumen for the last 5 years.
And what sort of imaging do we use in screening?
So we use, our main imaging modality is MR scanning, which is, as we know, radiation free. We also use ultrasound, which involves carotid Doppler, looking at the blood flow to the brain, and ultrasound of the abdomen, pelvis, and in males we also look at the testes.
What's a carotid Doppler?
So carotid Doppler basically looks at the blood flow from the heart to the brain. As you can see, these are the carotid vessels, and we are looking for plaques inside the vessels, and that's best depicted by the carotid ultrasound.
What is a plaque?
A plaque, as you can see, is thickening of the lining of the wall, which can reduce the caliber and ultimately reduce the blood flow. And it's one of the hallmarks or markers for high cholesterol and triglycerides in the body.
What are the main diseases that we're looking for with ultrasound?
So in terms of carotid Doppler, as I've already said, we are looking for the blood flow to the brain. But in addition, we look at the abdomen. We want to pick up any mass. We want to pick up stones in the gallbladder, in the kidneys. We look at the bladder. We also look at the testes. And in addition, we do female pelvic organs.
What is ultrasound particularly good at that you can see that MRI can't?
So in terms of the difference between ultrasound and MR, we of course know the technology is completely different, but ultrasound is really good for picking up stones which cannot be picked up by MR scan.
What is MRI?
So MRI is a non-invasive, non-radiation imaging tool that we have to look at any organ in the body, but it is especially important in terms of whole body screening.
What parts of the body do we scan with MRI?
So in terms of whole body screening, we use MR to look at the brain for picking up diseases like brain tumors, aneurysms. We also look at the blood flow to the brain. That's why we do something called an MR angiogram, which is just looking at the blood vessels. In addition, we look at the abdomen and pelvic structures with MRI scanning, which includes the liver, kidneys, prostate in males, bladder, and of course in females we look at the uterus and ovaries.
What is the point of an MRI angiogram?
So an MRI angiogram, as the name suggests, is to look at the blood vessels inside any organ. But in particular, we use that to look at the brain, to look at the blood vessels so we can pick up aneurysms. And the same goes for abdominal aorta, which is a main artery in your tummy, which also develops aneurysms. We can use MR to pick that up.
What is an aneurysm?
So an aneurysm is an abnormal dilatation of the vessel, which can ultimately cause the diameter of the vessel to increase and rupture.
What happens if a blood vessel ruptures in the brain?
Well, it could be catastrophic because it can lead to stroke or even death.
Why do we use ultrasound and MRI together?
So why do we use ultrasound and MRI together is a very good question, because the whole idea is to cover comprehensively the entire body. So there are certain things that are better picked up by MR scan, and there's certain strong points of ultrasound. So MR, as we know, is a non-radiation imaging tool that we have to look at your brain, the abdomen and pelvis, including prostate for screening purposes. Whilst ultrasound is really good to actually look for the blood flow from the heart to the brain, in other words, looking at your carotid arteries. And in addition, we look for stones in the kidneys and gallbladders that are better picked up on ultrasound rather than MR.
What imaging do we do to look for female cancers?
So female cancers are important, and the structures which are commonly infected are uterus, the cervix, vagina, and the ovaries. So we use both ultrasound and MR scan to pick up tumors and cancers in the female pelvic organs.
We scan the heart.
We do scan the heart, and the modalities that we use for scanning the heart are echocardiogram that we have here in our clinic. And in addition, we use a non-invasive CT coronary angiogram to look at the coronary arteries supplying blood to the heart muscle.
So tell me about CT coronary angiogram.
So CT coronary angiogram is different from the conventional angiogram where we put a catheter into the heart. So here we just put a dye into the blood vessels, which lights up all the coronary arteries supplying the blood to the heart muscle. So we can pick up narrowings, plaques, critical areas of reduced blood flow to the heart using a CT coronary angiogram.
What does the stress echo look for?
So a stress echo is primarily used to assess the strength of the myocardium, which is the muscle of the heart. So we do an echocardiogram before and after putting the heart muscle under stress and to see what the values of the heart muscles are.
Why do we scan the carotid arteries with ultrasound?
So why do we scan the carotid arteries with ultrasound is an important question, because carotid Doppler or ultrasound will demonstrate plaques in the carotid arteries, and we know there is a direct link between plaques in the carotid arteries and the plaques in the coronary arteries which supply your heart with blood flow.
Imaging that we use pick up male cancers.
Yes, can the imaging pick up male cancers? So yes, that's important, because in males the important questions that we are asked is usually, is there any tumor in the prostate, bladder or testes? And MR is really good for picking up cancers in the prostate. So that's why we have a dedicated prostate screening cancer detection program in our Lumen screening settings.
What about testicular cancer? What's the best way of picking that up?
So the best way of picking up testicular cancers is ultrasound, because ultrasound will demonstrate any lesion within the testes or around it, and hence it's really useful.
Is that something we do at Lumen?
Yes, so as part of our screening process, we include ultrasound, which, as I've mentioned, covers the abdomen and pelvis, but in addition, in males, we specifically do testicular ultrasound to pick up any tumors within the testes.